Hello friends, in this video we will discuss Gpsc Medical Officer Pathology question of 2021 paper. Let's start with the first question. The coefficient of variation of red cell volume is called as. So they are asking about the coefficient of variation. So the main thing here is the variation. So if we talk about the variation, then it is shown by the red cell distribution width, which is also called as RDW. So variation of the red cell volume is shown by the red cell distribution width. If we talk about the increase in the RDW, then it is seen in the nutrient deficiencies such as iron, folate or vitamin B12, and also it is increase in the liver diseases. RDW also increase in many other conditions also. We have discussed some of them. Next question is Heinz body in the RBC are due to. So Heinz body is mainly seen in the G6PD deficiency. So if we talk about the G6PD deficiency, whenever there is G6PD deficiency plus increased number of oxidants, these will lead to the cross-linking of sulfhydryl group. These sulfhydryl groups to the globin chain. The cross-linking of sulfhydryl group to globin chain will lead to the denaturation of the hemoglobin. So this will lead to this. So answer here will be option number B, denaturation of the hemoglobin. So we have discussed that G6PD deficiency and increased number of oxidants in the body, which will lead to the increased cross-linking of sulfhydryl group to globin chain, which will lead to the denaturation of the hemoglobin. So answer will be option number B, denaturation of the hemoglobin. Next question is lack or decreased synthesis of alpha A or B chain, alpha or beta chain of the HbA results in. So this is a direct question. Whenever there is a alpha or beta globin chain deficiency, it will lead to the thalassemia. So here answer will be option number C, thalassemia. Now next question is hypersegmented neutrophils are seen in the peripheral smear of. So this is a direct question and it is asked many a times in NEET PG and FMG also, that hypersegmented neutrophil is seen in the deficiency of the vitamin B12, which will lead to the megaloblastic anemia. So vitamin B12 deficiency will lead to megaloblastic anemia, in which hypersegmented neutrophil is seen, and also there is neurological defect. Neurological deficit present. Next question is the storage form of iron is. So this is again a direct question. The storage form of iron is hemosiderin. Iron is stored in the body in mainly hemosiderin form. Splenomegaly is characteristically absent in. So in amyloidosis it is seen. In chronic venous congestion it is seen. In chronic myelogenous leukemias it is seen, but in aplastic anemia splenomegaly is generally not seen. So here answer will be option number D, aplastic anemia, in which splenomegaly is generally not seen. Spontaneous bleeding may occur when platelets count is less than. This is again a direct question. Answer will be option number A, 20,000 per mm cube. So whenever there is a decrease in platelets lesser than 20,000 per mm cube, we need the platelet infusion in the body. If we talk about the dengue, then dengue is considered as the decrease in the platelets is dengue is considered when there is decrease from 1.5 lakh. But the serious situation of the dengue is considered only when there is a decrease in the platelets lesser than 20,000 per mm cube, after which platelet infusion is necessary. microalbuminuria is defined as protein levels of. So if we talk about the microalbuminuria, then it is 30 to 300 mg per dl. But if we talk about the macro one, then it is greater than 300 mg per dl. Next question is, renal calculi are commonly made up of. So we know that renal calculi are mainly made up of calcium oxalate. Now if we talk about the calcium oxalate, then they can be monohydrate, which are dumbbell shape, or dihydrate, which are envelope shape. So answer will be option number A, calcium oxalate. Benzone proteins are, so benzone proteins are mainly the light chains which are seen in cases of multiple myeloma. They are also increased in other conditions also, but mostly in multiple myeloma we see benzone proteins in urine, which are mainly the light chains. Diapedesis is immigration of leukocytes through the basement membrane. No, it is not through the basement membrane. Immigration of leukocytes through vessel wall to the site of inflammation. Yes, this is true, because whenever there is a whenever there is an inflammation, the leukocytes will go to that site of inflammation by moving out of the vessels, and they will move into the cavity around the site of inflammation. So here answer will be option number B, immigration of leukocytes through the vessels walls in the site of the inflammation. Next question is, which of the following is not an inflammatory mediator? So first option is tumor necrosis factor. We know that it is an inflammatory mediator. Myeloperoxidase is also a kind of inflammatory mediator, but it is mainly an inflammatory marker. So it is a marker. And nowadays myeloperoxidase is also used in the case of acute coronary syndrome. Interferons, yes, interferons are markers of inflammatory mediators. They are the inflammatory mediators, and interleukins are again inflammatory mediators. So here best answer will be myeloperoxidase, which is a marker, and it is nowadays most commonly used for acute coronary syndromes. Which of the following secretes histamine? So eosinophil, no. Basophil, yes, basophil will secrete the histamine, and also the mast cells. So mast cell and basophil mainly secrete the histamine. Neutrophil, no, and monocyte again no. So here answer will be basophil and the mast cell which will secrete histamine. Earliest change of neoplastic transformation as seen at the microscopic level is called as. So they are asking about the neoplastic transformation and also the earliest one. So if we talk about the normal thing, what is hyperplasia? Increase in the number of cells. Metaplasia is change from one type to another. Dysplasia is the disorganization of the arrangement of the cell, and it is the earliest change of the neoplastic transformation. After dysplasia, the cells will convert it, the transformation will be there, and after dysplasia the transformation will move into the carcinoma. So here answer will be dysplasia, which is the earliest change of the neoplastic transformation. So it is the early stage, and carcinoma in situ is the late stage of neoplastic transformation. The wasting syndrome associated with cancer is, this is a direct question, the wasting syndrome associated with cancer is called as the cachexia. Mean incubation period of hepatitis B virus is, so we know that hepatitis B virus incubation periods varies from 14 days to 6 months, which is about 24 weeks. So from 2 weeks to 24 weeks. So here best answer will be Option number A, which is 2 weeks to 26 weeks. Mean incubation period of hepatitis B will be 2 weeks to 26 weeks. Platelet activating factor PAF causes all except. So what is PAF? Platelet activating factor, and it will lead to increase in inflammation. Now, during the process of inflammation, bronchoconstriction will be there. This is true. Histamine release will be there. This is true. Decrease in vascular permeability. No, this is not true. Increase in vascular permeability will be there. And vasodilation will be there. So here answer will be PAF will not cause decreased vascular permeability. Instead, it will lead to increase in the vascular permeability. So answer will be option number C. Tuberculous granulomas consist of all except. So epithelioid cells are present. We know that this is true. Macrophages are also present. Fibroblast cells are also present. They can be present or not, but lymphocytes are again also present. So here all options are correct. So there is no correct answer in this question. But if we have to choose any one option, then fibroblast cells will be there. True about pheochromocytoma. So what is pheochromocytoma? We have already discussed that it is a adenal paraganglioma, or also called as the chromaffin cell tumor. Now, what is the rule of the pheochromocytoma? The 10% are bilateral, this is true. 10% are extra-adenal, this is also true. 10% are malignant, this is also true. So, all options are correct. If we talk about it more, then 10% in children's and 10% are familial. So it is all about pheochromocytomas. And what we see in the urine in pheochromocytoma, it is vinyl mandelic acid. Amyloidosis is most commonly affects. So first option is liver, second is tongue, third is colon, and D is heart. So among the following option, amyloidosis mainly affects heart. On second number, it will be kidneys. After that, liver will be there. So most commonly it will affect heart. So this is all about the pathology question of 2021 paper, and we have also discussed the other subjects 21 paper, and subject wise solutions are there, and we will discuss other papers also such as 2029 paper and 2017 papers in the upcoming videos. So you can watch those videos also and subscribe to our channel. Thank you so much.